Hi, I'm Jay Brown. I'm the owner at Hometown Smiles Family Dentistry in Joplin, Missouri. I'm a general dentist practice, so we do a lot of Invisalign as well. Big hygiene focus and just general dentistry. After being involved in our local component society, I realized that the MDA had a lot to offer as far as advocacy goes for me, even on a personal level. When COVID happened in 2020, it affected a lot of people in the medical profession especially, and in dental. There were a lot of question marks. Nobody really knew kind of how we were going to be fitting into that. I worked in a public health clinic at that time, and I had already planned on moving into private practice, so I had kind of put my notice in with them, and they kind of, in an effort to reduce costs and kind of close up their ship so they could kind of weather the storm, so to speak, were letting go everybody who already had their notice in. So it was me and one other doctor, which is totally fine and understandable. However, we were both on a National Health Service Corps contract. In that National Health Service Corps contract, there is a pretty heavy penalty for early termination. It was something that was pretty daunting to me at the time, being then recently unemployed and then trying to transition into private practice to have this looming over my head. So I did a lot of work on my own trying to get to the right people and trying to communicate with National Health Service Corps, and I just really wasn't getting anywhere. What I did was randomly submit, after a lot of frustration on my own, inquiry on the contact section of the MDA website, and that same day the executive director got back to me and was like, hey, we hear you and we're going to try to help you. She got me in contact with some other higher up people at the ADA, even all the way up to the ADA president at the time, who ended up writing a letter personally to our state and local representatives and Congress people, and even the head of HRSA at the time, to kind of ask for leniency in these situations. That was when I realized that the MDA is not just here for us on a professional level, but it is here for us on a personal level. Outside of advocacy, the MDA has really helped me on a personal and professional level with things as small as just finding, the right malpractice insurance or health insurance for my family that I wasn't able to find on my own, all the way up to, having brand new friends and colleagues that I can talk to about cases and really make me a better practicing clinician, and collaborating on things that I wouldn't really have had access to outside of that networking opportunity that is organized dentistry. Through my involvement with the ADA and more locally on the MDA level, I have really come to realize that the ADA and the MDA are not just here for me as a professional, but they're here for me as an individual.